YouTube, this is Angie the Coder, and as promised, today we're going to do a deep dive into the world of the AAPC coder. Specifically, we're going to take a look at the E&M coder. So come along, let's go out to the internet and take a look right now. Okay, first of all, we're going to go out to the AAPC coder software, which is out on the aapc.com website, and then we are going to scroll down the blue bar on the left hand side and click the little button that says coding, and then scroll down a ways, and then we'll hit the EM calculator. And now we're just going to jump in and we're going to start looking at the faux note that I created. Okay, so the first thing that they ask you to do is select your type of service. And I'm going to pull up the note so we can see what kind of service we have. Okay, our patient is an established patient office visit, and the date of service is 1/8/2020, and the patient is complaining of abdominal pain. So let's hop right on in, back to the encoder. All right, so select the type of service. It's going to be an office visit, and select the type of visit, and it's going to be an established patient. And then you can put your date of service in, so we get to mark the chief complaint as documented. Now we're going to move on to our history of present illness. And as you notice here, you can either do it like, you can, up here you can say 1 to 3 or 4 or more if you want to do it that way. But I like doing it this way. I like to do the number of elements, and then you can actually go and click the elements. And I'll show you at the very end when you get your little audit report, you're going to really like having done it that way. So we're going to flip back to the note, my handy dandy little note here. And right here it says Susan is a 36-year-old female with a 2-day history of sharp upper quadrant abdominal pain. She states that Motrin has not helped and the pain is a 5 out of 10. So now we have a little information. We can go back to the software, and let's put in our review of systems. So we know it was a right upper quadrant abdominal pain, so we have a location. The quality was that it was sharp. The severity was it was a 5 to 10. And the modifying factor was that she attempted to take Motrin to make it better, and it didn't work. So now we have that done. All right, so now we've done that, we need to do our review of systems. Now you can do, once again, you can do the same thing. You can just count them on paper or in your EMR chart, and you can just say, oh, well, they had 2 to 9. Or you can come down here and actually do the details, which I prefer to do because, once again, it gives you a really nice audit sheet at the end. So let's see if she got any review of systems documented. So we go back, and we go to the next page. Okay, so review of systems. The constitutional is she had no fever. GI, she had abdominal pain with nausea. GU, the patient can't remember her last menstrual period, and otherwise everything else was normal with her GU. And also all other systems are documented as normal. So we're going to go out and go back into our software, and we're going to do constitutional and GU and GI, and I always do them backwards, don't I? And then all others negative. And there we go. So now we want to know, does she have a past, what kind of past medical or family social history has been documented? Once again, you can do it up here without the details. You could say, oh, they documented 1, 2, or 3, or you can actually say specifically what was documented, which is what I recommend. So we're going to go back to the note. Okay, so past family and her social history. The patient is a G3P3, so she's been pregnant 3 times and she's delivered 3 times. She had a laparoscopic BTL back on 9/9/2019. She is married and sexually active, and her family history is negative for both ovarian and breast cancer. So let's see what we can do with that. So we go back in. So he didn't mention medications, prior illnesses, or injuries, or dietary status, but he did mention operations, the BTL, and her hospitalizations. We assume she was hospitalized for those deliveries, but we would have had it anyway for the operations for the BTL. He didn't talk about allergies or immunizations, but we've got those. All right, family history. He did mention the patient had a negative family history for some hereditary issues, breast cancer and ovarian cancer. And then the social, he covered both her marital status and her sexual history. And I'm just assuming my doctor is a male. I don't know why, because I'm the one that wrote the note, so I guess it could be a female since I'm a female. So anyway, we get to the end and we now have our history level. Our history level is comprehensive. So now we can move on to exam. And to do that, you just come over here and hit the little save button on the far right. And now we can move to the exam. All right, for the exam, our doctor is using the 1995 physical exam criteria, but you could do whichever. At our facility, our compliance plan follows Noridian, which is the detailed exam is a 5 to 7, and the expanded problem focus is 2 to 4. So let me go into a little more detail on that. This is a really cool thing about the software. It depends on, it lets you choose the 1995 exam criteria that your physicians have put in their compliance plan that they follow. So say your guys are CMS guys. Then, they put in their compliance plan, we follow the CMS guidelines for the 1995 exam, then you would click that button, and then that one would say that to be a detailed exam, you have to have 2 to 7 organ systems with 1 in detail. All right, so let's go take a look and see what we got. There. Pretty brief exam. So the exam for the constitutional, he documented the patient is not in acute distress. She has a temp of 98.6 and blood pressure of 120/60. For the GI exam, he noted no masses. There was right upper quadrant tenderness to palpitation and normal bowel sounds. And then he deferred the GU exam and nothing else is documented. So let's get this on the form or in the system. So we had constitutional, and when you click that, it's interesting. I love this. See, no acute distress. A lot of the terms that you would see documented are actually kind of listed there. So he got the constitutional, and notice it also says, for instance, vitals, which he did cover some vitals. All right, did he do eyes? No. ENT? No. Cardiovascular? No. Respiratory? No. Gastrointestinal? He did. And GU he did not do. Musculoskeletal, skin, neuro, psych, and hemolymphatic. None of those were done. So you are done indicating what exams. All right, now, so if this had been the CMS guidelines, you would have a little box right here that would say if one is in detail to click here. So if you had 2 to 7 and one was in detail, there would be a box here. And I'm going to show you that really quick, but we're going to stick with the Noridian exam, for this example, but I'm going to show you how this works. So we're going to take the same note, and the patient had constitutional, they had gastro, and that was it. But let's say that gastro exam was in good detail, then you could mark 1 or more areas or organ systems were documented in detail. Now that's going to give you a detailed exam. But if you go back and you take that off and change it back to the Noridian, and see the box went away, you can't mark that one was done in detail. Now you have down here expanded problem focus exam. So see, it's a very important thing that you know which set of guidelines that your providers follow, what they have in their compliance plan, and then you need to follow that when you audit them. And what's cool is the software allows you to do that very nicely. So if you go to the next, so we're going to save our expanded problem focused exam, hit the save button, and now it's time to do the decision making. Okay, his impression and plan. Right upper quadrant abdominal pain, in-office urine pregnancy test was positive. He ordered a transvaginal ultrasound and a transabdominal ultrasound to rule out ectopic pregnancy. Okay, so if you hit the back button, it will take you right back to that last screen. See, we're on our medical decision-making screen. What we want to do now is, and we have our 4 points. I'm going to try to zoom in. This is what keeps causing me trouble. I'm going to zoom in and show you we have new problem with additional workup planned. We have one of those, 4 points total for the presenting problem. And there was nothing else, so we're going to leave it at that. And then we're going to come down here, and this is the amount of data that he reviewed. Okay, so he reviewed a clinical lab, so because he did a urinalysis in the office. and he ordered 2 ultrasounds. So there you go. Now you have your points down here. Zoom in. You have a total of 2 points down here. And now we're going to look here. So this is the table of risk, and I know it's kind of big and it might be kind of hard to see on the internet. We're going to do our best here. This patient has come in with a undiagnosed new problem with uncertain prognosis. So this is a new problem. He's having to do some labs, ultrasound and labs to find out what's really going on with her. And honestly, he didn't say this, but if she does in fact have a tubal pregnancy, he will be doing emergency surgery on her as well. That wasn't in the notes, so we don't get to do anything with that, but because we can't assume. So let's go. That's this column, which is the presenting problem column. Now we're going to go to the diagnostic procedures order. So he ordered a lab, but it did not require venipuncture. It was a urinalysis. But there it is. There's your urinalysis. He ordered urinalysis and he ordered ultrasounds. So that's that. Now if you come over to the next column, the final column is the management options selected column. He's not to the point where he's made a determination of how he's going to treat this condition. He's still trying to get to the bottom of what the condition is. So there's really nothing we can mark in that final column. So as you see, we have a final decision making of moderate complexity. Then you're going to hit the save button and it will give you your final level of 99214. Now wait for it. We're going to go down there and we're going to press the button that says download PDF. And it's going to bring up this really great EM calculator report. Now this report is something that you can use if you're doing audits, or if, say, you're a coder and maybe your physician marked off on the super bill that he thought it was a 99215, but then when you did your review, you came up with a 99214. You can either sit down with him with a copy of this audit sheet, or you can send it to him, say, via secured email, and show him why you think it should be a 99214 based on your audit. It's really handy for that. And like I said, this is an encoder that I believe I pay $40 a month for, and it has this wonderful EM auditing software in it too. So it's just really, really nice. So that concludes my review of the EM calculator in the AAPC coder software that I really like. I can't say enough good things about it. I promise you this is not a paid endorsement. I wish it was. I wish they were at least giving me my software free, but they're not. This is just a product that I pay for and use myself, and I really like it, and I hope you do too. So if you like what I'm doing, please subscribe to the channel, give me a thumbs up. If you have any comments or questions or anything you'd like me to do a video on, please leave that in the comments below. I love hearing from you. And hit the little bell if you want to be notified when I drop new videos. And everyone have a great 2020 year of the coder.